Fantastic. Thank you, Peter. And great to have all three of you with us today. Just an honor to be talking about such a really revolutionary platform. And would like to first get into what some of the barriers are that we're seeing. And we know that digital health is slowly kind of underground transforming a lot of things. Some very high level visible things are being transformed around it. Your platform is something that is seeing a tremendous, as Peter mentioned, groundswell of support, of adoption. But one of the things that we're talking about at this conference this week is around access. And if you could start, Jenny, and I'll ask all three of you the same question, but what are some of the primary barriers to access for rehab for patients these days that you're seeing?
Absolutely. So one of the primary barriers that we see patients face is actually eligibility. And when we talk about eligibility, we start by looking at what is traditionally considered eligible for cardiac rehab. And you have about 7 diagnoses for that. Heart failure, heart attack, stent, bypass surgery, valve surgery, and then a heart transplant. But let's take heart failure specifically. And I want to point this one out because I think the limitations are so vast. So for example, traditional cardiac rehab heart failure is chronic, stable, with an ejection fraction of 35% or less. So what do we do for those patients who have an ejection fraction of 36%? Send them home and say, well, wait till you get worse, and then come back. What do we do with right-sided heart failure? They never qualify. So when we look at this, and Medicare has been looking at this data for many years, but let's just take the last 15. So in 2008, they focus on hospital admissions, and they focus on 30-day readmission. So in 2008, there was 800,000 patients, Medicare patients, hospitalized with heart failure. In 2007 to 2009, on average, there was 100,000 admits, 30-day readmission. In 2022, there was 3 million hospital admissions, and $15 billion was spent by Medicare on 30-day readmissions for heart failure patients. In 15 years, nothing's changed. In fact, it's just gotten worse. And when we look at that, we ask the question, and the question I think Medicare has asked is, how do we stop that? How do we stop the hospital admission? How do we stop the 30-day readmission? And they've implemented some great things to counteract that, but that's the wrong question. The question is, how do we prevent initial admission? How do we stop that from getting to the point of an event? And the way to do that is to make more people eligible. We don't need just 7 eligibility criteria for cardiac rehab. And so I really want to open up with the next topic of eligibility or a barrier with Dr. Bhusri, which will be time.
That's great, yeah. Go ahead, Ashley, build on that too.
Do you want to talk about the time component as?
Yeah, so when we're talking about heart failure, I have a unique aspect in that because I'm on both sides of the equation. I am a cardiologist in private practice, but in 2015, my heart stopped and my ejection fraction, which is the measurement of how strong your heart pumps, was 7. 55 being normal. So I was transported to a transplant center and in a coma for about 6 weeks and never got a transplant, but ended up surviving and basically being on every medicine that I prescribe my heart failure patients. And I will tell you that the biggest thing that really saved my life was going to cardiac rehab. Now this was in 2015 before COVID. And I'll tell you, when I left the hospital, there was an 8-week wait just to start cardiac rehab. 8 weeks of me laying in bed and getting my functionality, my frailty or my frailty index getting worse. And so now when I present RecoveryPlus to my patients, it is the availability, the instant availability. And just like Jen said, that the idea is to catch it early and get them moving fast. And I tell my patients the best pill that I ever took to get my heart better and for me to stay alive was not a pill. It was cardiac rehab. And that now, since 2020 and in COVID, with the acceleration of health tech, and as we all know in medicine, things take 10, 20 years to evolve, but the acceleration that was adopted in 2020 and the changes to CMS guidelines has allowed, also when 5G starting then as well, allowed this huge boom of healthcare. And a lot of my patients who are not on the Upper East Side need cardiac rehab. And with RecoveryPlus having this hybrid protocol, they can get this cardiac rehab anywhere while they're on vacation, whether they're out in Eastern Long Island. I have patients who are as far away as Singapore, and they will do it. They will do the cardiac rehab, and they will come back and they're saying that they feel stronger, better, and guess what? I'm taking medicines off because their ejection fraction is getting better. So I think availability is the most important problem, but solution that we are finding now, which is great.
No, that's fantastic. Ashley, how can you build on that? What else would you like to add?
Yeah, I think you brought up the point of their geographic location being a huge element as well in terms of access to care. When we think of geographic barriers, we usually just think of like rural barriers, urban barriers, but we also have to consider transportation and climate, right? So Tim, who's one of the co-founders of RecoveryPlus, is from a very rural area of Texas. The nearest cardiologist is hundreds of miles away. So his grandfather came down, had a cardiac event, and he had to go to a cardiologist that was a 2-hour drive away. And then he had to go to cardiac rehab 3 days a week. Again, 2 hours there, 2 hours back. So his family and friends were taking off from work. They were taking off from school to take him 3 times a week. And we recognize that that's not really possible for everyone to do. And the studies are showing that 30% of individuals in rural area are less likely to go to cardiac rehab because of this. So proximity to a location is a really significant barrier. You also have to look at we talked about availability as well, but in terms of around the country, New Mexico, for instance, has 143 cardiologists, or 146, I believe, to serve a population of 2 million people. And New Mexico is the 5th largest state in our country. So you can only fathom what their proximity might look like in order to get to and from rehab. And then kind of take a look at the urban environments, right? Here in New York, you have some of the best cardiologists, world-renowned cardiac rehabs, a couple miles away. But how do you get to them, right? Of the 472 subway stations, only 27% of them are accessible. So I was on crutches for the past 4 months, and let me tell you, it is challenging to navigate those subway systems. First of all, just figuring out which ones have an elevator, and then trekking from one platform to the next, and then leaving the station, actually getting to your appointment. That's your zone 2 cardiac workout right there. So for individuals that are deconditioned or have limited mobility, even if a location is 2 miles away, it might be incredibly challenging for them to get there. And New York has also some wonderful services such as Access-a-Ride, but even that, individuals are being picked up 7 a.m. for their 11 a.m. appointment, right? It's a ride share. So that plays a huge impact on what their day-to-day life might look like, work, childcare, further limiting them from getting the care that they need. And then, of course, climate. We're coming across the winter months. It's getting cold. It's getting icy, further putting people at risk of falls. You have to look at the areas where it's incredibly hot and also puts them at risk. And then, be remiss not to mention the air purity we all experienced a few months ago. No one left their house. So whether they're on vacation or simply live in an area where they can't get to care, that geographic barrier has been significant that we've noticed.
It's so interesting too, and really it sounds like you're touching around this kind of theme that we've seen a lot this week at the summit, which is around how providers and how others can help improve the accessibility of these important, not just medicines, but therapies for populations, especially diverse populations. Is there anything else, either Dr. Bhusri or Jenny, that you want to add to that?
Yeah, so I want to reiterate, so RecoveryPlus is virtual cardiac rehab. So, when we look at the barriers, we address each one of those and so much more. But just taking eligibility, so RecoveryPlus alone, we only need 2 chronic conditions. And I think oftentimes we kind of overlook some things that lead to really big health impacts, that lead to heart failure, that lead to hospitalizations. And those are things as simple as high blood pressure and obesity, diabetes, long COVID. That's a new one that we're now dealing with, and we're seeing the huge health impacts that it has. So just 2 of those is our eligibility criteria. So when we talk about eligibility from a Medicare standpoint, it's so limiting when we talk about the traditional cardiac rehab sense, and we know that so many more people need it. And when we talk about readmission rates, that's what we're missing. We're missing the bigger picture of who we can treat and who needs our help. Our readmission rate is 2.4%, and that's in 3 months, not 30 days. It's even less. So as for time, RecoveryPlus is an app. We have an app. It is medical grade. Our patients can use that anytime, day or night, wherever they are. We have one-on-one exercise physiologists that custom build programs for these patients to their diagnoses. So that's how RecoveryPlus is really answering these kind of burning questions of what do we do next? How do we address the barriers? We know what they are, but what do we do for these barriers? And so this is how we have answered that. We bring what the patient needs to the patient, no matter where they are, and we have opened the doors to so many more patients that need the help.
Yeah, it's so critical in this day and age, even with all of the technology we have, like you mentioned with the towns in Texas or even the towns of Vermont, where the closest cardiac rehab center could be an hour and a half away by car. And in New York City, where you have 80-year-olds living on 4-story walk-ups, the ability to get to these centers is not that easy. So let's just wrap this up. And again, I'd like to ask this question now for all 3 of you, but any final thoughts on what we're seeing in digital health and what we're seeing specifically with RecoveryPlus around being able to open up accessibility for therapies and things like this virtually to patients, especially patients that are in diverse areas and whatnot. But we'll start with you, Dr. Bhusri.
Yeah, I touch on 3 points. One is patients don't want to go or they can't go, and my response is we come to you. And that just changes the whole relationship with the physician and the patient. And while we come to you, while RecoveryPlus comes to them, RecoveryPlus is also monitoring them for me in real time, and we're preventing the second point, which is 30-day readmits. And that is huge for healthcare systems. That's huge for CMS. That's a big 30-day thing that we look at in the state and CMS looks at. And third, and finally, a big thing for physicians who utilize home-based cardiac rehab. We do know that multiple studies from the AHA have shown equivalent, if not better, outcomes with home-based cardiac rehab, but the reimbursement to the physician is excellent, and it's still past the public health emergency because validity has been shown that home-based cardiac rehab does work. So the provider wins, the facility wins, most importantly, the patient wins, and that's what we want to take away from this.
I think also for millions of Americans, RecoveryPlus is not just an option, it is the only option. It's opening up access for individuals that otherwise would never be eligible. And like Jenny mentioned, our mission is not just to reduce readmissions, it's to reduce admissions in the first place, and we can only do that by increasing access to care.
Jenny, final thoughts?
Yeah, so overall, I'm very passionate about this. I think that the key takeaway here is that RecoveryPlus looks at solutions. So many times we look at the barriers, so many times we look at the hurdles that patients encounter, how hard it is for everybody. But we have created a way for patients all over the United States, all 50 states, to get one-on-one access to this life-changing, life-saving care. And I think that that is, again, it's life-changing. So.
No, it's fantastic too. And just for the audience, both here and around the world who are watching on Zoom, the idea that HitLab has actually studied this platform and seen its efficacy technically, economically, certainly clinically, and from an integration standpoint that way as well. I think the economics of it are particularly interesting because we're seeing now not just a digital health platform that's going to be good for the patient, but one that helps the facilities and the physicians optimize revenue, which is really critical in this very, very difficult financial era of the US healthcare system. That's an important point that everyone should be thinking about as they're starting up companies and starting something new. The idea of how does this help improve the financial situation of the hospitals and physicians out there? So important, and this is a platform that covers that. And you can see our research. Again, there's posters over on the sides of the walls there. Take a look at the research there for not just the evidence of the technical merits of a lot of these digital health platforms, but also the economic and certainly, most importantly, the clinical. Thank you all for joining us today, and thanks to everyone here.
Thank you.